It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So my friends, what do you know about concussion? You know, sometimes you fall, but what is really a concussion? Well, great show today. I'm here with the concussion team here at the Health and Wellness Center right here on the Airport Beltway. Now, I want to put a phone number on the screen because you may have some questions, and it's 570, same old number, 5014-LVH. Now, this is the concussion therapy team. What do they do, who they are, how can they help you, and how do you know if you have a concussion? I know I've had many concussions in my head that I should have come up here for therapy, but you don't know that. So let me introduce the team. We have here your name?
Jennifer Hoats.
Okay, and your name?
Georgette Herring.
And your name?
Ashley Schartzer.
And two guys here, that's it. And
Ken Wenner.
Okay, this is the therapy team. So want to welcome everyone to the show today. And don't be afraid to talk because we want to know about concussions, okay? All right, so tell me a little bit about yourself so people know that they have qualified people here at the Wellness Center. Tell me a little bit about yourself, Jen.
I have been treating in speech therapy for 14 years in the area of head injury and concussion. I'm a certified brain injury specialist, and most people kind of think speech therapy, what does that have to do with concussion? I can still talk, but we treat the cognitive aspect.
Okay. So we're going to understand a little bit about the difference when a person, how do you recognize when you get a concussion versus a stroke, okay? Because sometimes you don't know whether it's concussion or stroke, and we'll go into that, correct?
Yes.
Okay, and tell me a little bit about yourself, who you are and your background.
My name is Georgette Herring. I'm an occupational therapist and a vision therapist here at the Wellness Center. I've been treating for around 9 years now, and I'm impact trained, which is ITOT, an impact trained occupational therapist, and that goes into getting the baseline for concussions, and also doing even post-treatments for them. So I've been doing the vision therapy for over 5 years now.
And we're going to show a little bit of that in a little bit in the show. Okay, all right. So tell us a little bit about yourself.
Sure. My name's Ashley. I am with the Health and Wellness Center here in physical therapy for about 3 years now. Like Georgette, I am also impact trained physical therapist, and that, like she said, is helpful to athletes returning to sports after concussion.
And Ken?
I've been a therapist here at the Wellness Center for 8 years. Treated a lot of sports injuries for about the first 6, and for the last 2, I've been treating primarily brain injuries and concussions.
All right, now I have a number of questions here, folks, that I think you're going to be interested in, because remember I said sometimes people get concussions and they don't know they have a concussion. I'm going to start with Jen. Okay, Jen, after a head injury, what are some of the common symptoms people with a concussion will experience?
Mostly they will have dizziness, headaches, loss of balance, visual disturbances, possibly seeing double or blurred vision. They will have problems with attention and focus. Most patients describe it as having brain fog and memory impairments.
Okay, so that I asked before, okay, the difference between if a person is having a stroke, a slight stroke or whatever, is there a differential here?
There is, and typically a person would know that it was concussion versus stroke because with a concussion there's some sort of injury to the head. They either had a fall, they were in a car accident, they were playing sports and they took a hard hit. There's usually some sort of injury that's associated with that brings it on versus a stroke, which will come on suddenly.
Okay, now you have a child, okay,
yes,
10 years old, okay? Believe it or not, she has a child, 10 years old. But okay, so a lot of kids fall.
Yes.
And a lot of kids bang their heads, okay? So do we automatically rush them up to your place or to the hospital? How do we tell, it really is something we should be concerned about?
Yeah, you want to monitor your kids if they're complaining about headaches, if they don't seem like themselves, if they're having, a lot of lethargy or fatigue that is atypical for them. If they're making any sort of out of the normal complaints, you would definitely want to take them to the emergency room for an assessment, and they would diagnose them with a concussion at that time.
Well, it leads me to another question. Okay, so I'm around the house, and there's a shelf up there, and I'm done, bang, I hit my head on the shelf, and I'm like a little woozy, etc. Do I wait a little bit? What should I do, or do I run up here real fast?
Typically with a concussion, you're not going to pass out and, die on the spot. You don't have to panic, but you will be experiencing symptoms if it's something that you need to get checked out. If you're having a headache, a lot of our patients show up and they're saying, I didn't have any symptoms at first, and then I woke up the next day and my headache was so severe and I was so nauseous and I just didn't feel well, and they go to the emergency room at that time. It is something that you want to get checked out if you have any concerns at all.
So basically, you'll be able to tell whether it's something serious. I know
if there are symptoms present, go and get it checked.
Yeah, because there's some hard-headed people that, me, right here, starting with me, it's okay, I'll wait, and then when it's really hurting you, then that's when you make the phone call. Thank you, Jen. Now, I want to ask Ashley, okay, when should someone see a health care provider for a head injury? They'll just ask you to see if they have experienced a concussion.
So along the lines of what Jen had just said, if you're if you have symptoms the next day and you're feeling the headache, the nauseous, the dizziness, some extra fatigue, that's when you want to go to your healthcare provider or an emergency department and get checked out for a concussion.
Okay, so how do they get referred to the team for treatment?
So they can be referred directly from the emergency department. A lot of the providers in the area are now sending to our concussion clinic, which is in Allentown. They do comprehensive evaluations down there, and then they refer back to us here in Hazleton for the surrounding areas that people don't have to travel down to the Allentown area.
Okay, so would it be when they're referring them to here, okay, when did you decide that they have to go to Allentown?
We typically set goals based on what the person is trying to achieve, whether it be sports, back to work, and when they are reaching those goals, we recommend that they follow up at the concussion center at that time.
Okay. What is the goal of the concussion therapy?
The goal is to get the individual back to what they were doing before. So, if it's a teenager who had a sports injury, we want them to improve to a point where they're able to return to play. If it's an adult who maybe was in a car accident and they're not able to work, our goal is to get them back to normal so that they can complete their household tasks, return to work, do what they were doing before. Okay. So 100% recovery is our goal.
Terrific. Now, here's a question here, and I alluded to this before. What are the dangers? Are there dangers to not having concussion therapy or treatment after a concussion?
Every individual is different. Some people do recover in the typical 24 to 48 hours after a concussion, but for an individual that's not recovering, sometimes we see people who have symptoms even several years later that possibly therapy early on could have helped them.
So is there medication involved sometimes that the person has to take if they have some kind of concussion?
Yeah, sometimes the doctors do prescribe medication. As a therapy team, we don't handle that, but when they come to us from the concussion center down in Allentown, a lot of times they've been prescribed medication to help with the nausea that comes with the dizziness, or possibly medication to help them with sleeping.
Okay. So folks, that's why the importance of the team here is critical. If you just tune in, I'm here at the Health and Wellness Center here in Hazleton. This is the concussion therapy team. As you heard before, well qualified, extremely well qualified. Georgette, tell me a little bit about the concussion therapy program here at the Health and Wellness Center.
So what we do, Sammy, is we actually start with initial evals. Each one of us does our initial eval, usually about a half hour to an hour, and then we will schedule the patient for treatments after that. We try to work with the patient's schedule as much as we can to get them all in the same days, and then we decide at that point, after the initial eval, we should have them on, how many days, how the length of time, the length of treatment.
Okay, the other question is, what does a normal course of treatment look like?
Sure. So normally the patient will be evaluated for all three disciplines as long as the doctor prescribes them. Sometimes we can, if the patient only comes in for, say, one treatment, so say if they came in for physical therapy, sometimes the physical therapist might say or recommend occupational therapy or speech therapy, depending on how the patient is doing or how their symptoms are.
How's your success rate?
Very good. Every patient is different, but we do like to get them to that, at least 90, between that 90 to 100%. But again, everybody is different in how they tolerate the treatment a little differently, but we've had very good success rate.
So how long have you been doing this treatment?
This treatment, we've actually started our concussion program about 2 years ago. So, and I would say from that point, I would say about 90%.
Yeah, well, that's great. I guess the team effort here is the most important thing, correct?
It is. We collaborate with our treatment plans, we make sure that what each discipline is doing with the patient, what affects that patient. We really we take the patient's care into consideration.
So really, it's something not to be, not to look down on. It's something that you should really go after therapy or go to a doctor if you experience a concussion.
Correct, Sammy. I do think that, I do believe that. And some patients aren't here for very long. You know, sometimes their concussion symptoms are mild, and they really need what I call as a boost.
Okay.
They kind of need that little bit just to get back to their normal routine.
Okay. Jen, do you have any special certifications?
Yes, I am a certified brain injury specialist.
What does that mean, brain injury specialist?
It's additional training that you do that gives you increased knowledge in an overview of brain injury. So, you know, when you go for the certificate, you have to be knowledgeable in the medical end, the therapy end, the social and emotional end of brain injury. So it is an extensive training, and then you do continuing ed in the area of brain injury to keep that certification up.
Now, the other thing here is that when you're looking at people having a person double talking, okay, after concussion, why would you need speech therapy?
Right. Most people think, like, I talk fine, what do I need speech for? But speech therapy works on the cognitive end of things. So, you know, we're working a lot on those attention problems that people will experience after a concussion, working a lot on the memory. Problem solving is typically less affected in concussion, but sometimes that is affected as well, and we work on that in addition.
So the speech therapy really has a lot to do with helping a concussion.
Right. Really, one of the biggest complaints that people have after a concussion is, you know, I have such a hard time concentrating. And that impacts your function overall. If you can't concentrate on what you're doing, you're not as productive at work. If you can't concentrate on what somebody's saying to you, you're not going to remember it later. You know, concentration and your focus really overrides a lot of other cognitive tasks. So, you know, that's one of the things that we really focus on, kind of get people built back up to a level that they're able to function again.
Okay, I didn't have a concussion, but I'm using this in general terms. I didn't have a concussion, but I'm having trouble thinking and talking, etc. So should I call and find out why? I didn't bang my head, but I have those symptoms.
Well, and if you do have those symptoms, and it's something that's a new onset, it's definitely something to take up with your primary care physician. You know, there's a lot of other things that can cause similar symptoms, you know, whether it's just normal aging or whether it's something that's more pathological. Your primary care physician can sort through that and give you a referral if it's appropriate.
Terrific. Folks, remember I talked about healthcare in the greater Hazleton area? Well, surrounding all the areas here, okay? Here's a professional team. You heard the qualifications. We're going to take a break. When we come back, we're going to learn a little bit more about what happens with a concussion and how they make you better. We'll be back right after this.
It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome back to the Sam Lesante Show, folks. I'm here on location at the Health and Wellness Center rehab area. Okay, this is the area where they treat concussions, and we had the concussion therapy team on. Now I'm in here with Georgette, and Georgette is going to show us what some of the things she does on the computer. But before I ask you this, or let me ask you this, why was my vision affected by the concussion?
Sam, usually a blow to the head, any type of blow, if it's mild or severe, it will, what it will do is it'll affect the vision. And what happens is it'll actually, the eyes will come out of focus, or sometimes people lose accommodation, and what they start to sense are symptoms, that dizziness, nausea, hypersensitivity to light and movement. So there are a lot of things that could go wrong. Once there's a blow to the head, it can affect the vision.
Okay, so in staying with that, okay, what are the general eye movements of the eyes?
Sure. What we have is we have a saccadic movement, which is a fast, jerky, rapid motion. Then we have pursuits. And then we also have like some scanning and tracking things. So like I usually give the example of mazes. That's a very good one to to work on like the tracking and scanning.
And where does this come in for the movements?
So what we can use the computer for is to help strengthen those movements. And to really, what I would do at the initial evaluation is I would take some numbers on here, and then I would be able to reassess and see where that patient is at.
Give me a quick example.
Sure. So saccades, this one, what I will do, so what the patient has to do is take the gamepad, and they have to go as fast as they can using the gamepad and telling me which way the arrow is pointing using the gamepad and looking at the screen. So this is going to really make the eyes kind of move around the screen to start to strengthen those muscles around the eye.
So they have to say left or right or down or up.
Correct. Using the keyboard.
Oh,
using
okay.
the keypad.
Okay. So where's left?
So what I'm doing is I'm actually using the dial here to be able to tell, like looking, taking that information in and then be able to.
Well, are you moving the arrows?
I am.
And
yes.
And so they have to then put up, down, left, or right.
Correct.
Okay.
Yes.
And is there like a general rule that they should have so many correct or?
Yes. Normally, and I will escape out of here. Normally where I want to see the patient as far as accuracy wise is about 95 to 100%. But then I also want to see how their response time is. So when they're looking at that object, responding to it with the answer on the keyboard, I want to see how their response time is.
Wouldn't it be sometimes people are not as quick, but it's up, down. I mean, wouldn't it be better verbally if I say up, down, left, right? I mean,
yes.
Other than.
What I will do is I will make modifications to the patient. So actually, my oldest patient that I've had on here was 82.
Okay, yeah.
So I will, if the patient is not comfortable with the computer, I will help make that modification.
Okay, yeah. Mm-hmm. It reminds me when I go for my exam, left, right, and you hit something.
Yes.
So what is a VTS3 computer system?
So this is a vision therapeutic system. It is the version 3, so it is a little bit older model. However, it still gets the job done.
Yes.
And this will take in, we can go over all the general eye motions. We can use, it actually gives me liquid crystal glasses that help see almost like a 3D perception to help with strengthening of the eyes as well.
Okay, and that's part of the movement test?
Correct, yes.
Okay. And so I guess it's hard to demonstrate that. Is it how?
Normally you cannot see it, but when the person puts the glasses on, what I will do is this helps to see how their eyes are verging or actually working together. So what it would do is when you put these on, if I pull one of the activities up, we cannot see it, but once the patient puts these on, you can see what they will do is they will answer kind of the same way the arrows are.
Yeah. What are some of the things they would see?
What they would see is actually a square. What they're going to see is a square within a square.
Okay.
So it's almost how I say it is an invisible square.
Okay. Yeah.
And you have to tell me if it's up, down, left, or right.
Now, do you move that square too?
Yes, and they can do it with the keyboard or the keypad. I'm sorry, or the keyboard.
So it's like 3D to a degree.
Correct. Yes, it's a little bit of a game. But what this will do is it'll help strengthen or push the eyes in a certain direction where I want to strengthen them. So that it can overall strengthen the eyes and help them accommodate back.
Okay, so I have a concussion. All right, banged my head at home, etc. And I wanna know if I really there's a problem here. Is there any kind of exercise I can do at home?
Yes. What I will do is I actually give a printout for the patient, and I go over everything as far as the saccades, the pursuits, how to modify them at home that will help build those activities.
So it looks like you have a complete, this whole therapy team, you got everything covered, correct? Yeah.
We try, yes, yes.
Well, first of all, as I mentioned before, Georgette, we have experienced people that know what they're doing, and that's the most important thing. So Georgette Herring, folks, is part of the concussion therapy team that's up here. I know sometimes a person falls, they hit their head, etc. It's best to call 570-501-4LVH, and you'll find out what to do, okay? Now we're going to go and we're going to talk about physical therapy. All right, now we have the physical therapy area, folks, and I have Ashley here, and we have Ken strapped like he's going to be jumping off a plane pretty soon. So let me ask you this, okay? How long will I need to attend therapy until I am resolved of my concussion symptom?
Sure. So every individual is different. Typically, we see somebody until they can reach their baseline level. So if you're going back to work at a factory, we make sure we can do your job without symptoms. If you're going back to sports, we want to make sure you can do your normal sport routine without symptoms, and so on.
What's baseline level? What is baseline level?
Prior to your head injury. So if you were a soccer player, took a hit to the head, and now you have symptoms of dizziness, balance, memory fogginess, we want to make sure none of that is happening before we say you can go back to your sport.
Where do you see most concussions coming from?
We see a lot of concussions from car accidents and older fallers.
Okay. And I mean, how about sports? Is there a lot in sports, or is there, because I know sometimes young kids are playing football or soccer or basketball, you know.
Yep, we absolutely see a great deal of sports injuries too, but believe it or not, motor vehicle accidents seem to be #1 for concussion with us so far.
Now, how many days a week will I need to attend therapy?
So once you're evaluated with your physical therapy, your speech therapy, and your occupational therapy, we follow Lehigh Valley protocol based on your symptoms of subjective pain and dizziness and your objective findings on our assessments. And you fall into a category if you should be 1 time a week, 2 times a week, or 3 times a week based on those findings.
So will determine whether I have to come here once or twice, okay? Now, we're here, okay, and we have a computer, and we have this guy strapped up. Okay, he's not taking off, folks. Explain exactly what goes on here. Now, I'm going to stand over here so you can explain to the viewers what's happening.
Sure. So this machine here is called our NeuroCom Balance Master. We are the only one in the greater Hazleton area that has one, which makes us a little bit different than most other programs. The machine breaks down your balance systems into your vision, your somatosensory system, and your vestibular system. Those 3 systems kind of fine-tune your balance. So if one is malfunctioning or affected from the concussion, that's what's going to make you feel off balance. So this kind of zones us in a little bit onto what we can work on to make your balance back to where we need to.
So let's see a demonstration.
Sure.
I know Ken's getting ready to start it, right, Ken?
I'm ready.
Are you there, okay?
So what I'm going to do in this one is I'm going to ask Ken to stand as still as he can. I've lined his feet up to where it should be because it will match you to averages for your age and your height. So you are not going to be compared with somebody who's 18 years old and can balance on a balance beam. It's going to group you into those normal categories based on your age and height. So he's already been set up. So on this one, I'm going to ask him to stand still with his eyes open. I'm not going to tell him necessarily what to expect. That's going to skew his results. So I'll just say, remember, Ken, that the machine might move during this test. Just try to stay as still as you can. You'll see here on the screen as he's in the machine, this stick figure is his movement. So if he moves, that's going to show me that he's swaying either posterior, meaning backwards, or anterior, meaning forward. And this green bar going across is his length of his test. So we just want to make sure that he can stay within that grid as still as possible during the testing. After that trial is done, you'll see a bar graph come up. And if he falls below that gray shaded area and his bar graph is red, that means he fell below the average for his age and his height. So that would be something we want to look at a little bit further. So in that specific trial, what was happening is Ken's standing still and the walls are moving every degree forward or backward that he's swaying. So if I'm standing still and I move 1 degree forward, the walls are going to move with me 1 degree forward. So in the next one, I'm going to ask Ken to stand still with his eyes open again, as still as he can. And again, you can see if he moves, the stick figure is going to move. Again, I don't want to tell him what's happening so that he doesn't have any anticipation. And when he's all done, we'll look at how he does with that one. This one here is testing more of the floor. So if you're on an uneven surface,
Is something moving now?
the floor in the machine is actually moving, yes. So if he
So he has to stay still?
yeah, if he moves forward, the floor is going to move
Okay.
forward with him.
All right.
So the hardest one that most people have difficulty with, I'm going to jump ahead a little bit, is this one here where their eyes are open and I ask them to stay as still as they can.
Oh, now the unit is moving.
The unit is moving both the floor and the wall for every degree he's moving. So if he was to lose his balance, I would stop the test. And what that's going to do is flag it as a fall. So we're going to mark that as a fall. And that's going to tell me when I go to retest him next time, have we improved? Is he able to make it through that test?
So with that, so then you're getting an understanding of what, the person can stand or what. So what happens if this is not a good test?
Sure. So when he's all done, I would go to his assessment. I'll show you that quick. Now, we didn't do the complete assessment on him, so you'll see that not everything is filled out, but this would tell me a lot of information and give me an overall assessment. And if he fell below that, that's going to tell me how much percentage-wise below the normal he is for his age and his height.
Very interesting. So what is the difference, okay? What makes your therapy different than somewhere else, okay? Because, you know, you have an experienced team here. It's vital to have experience in different areas, whether it's visual, whether it's speech, or what you're doing. What makes you different?
Sure. I mean, we have the healthcare practitioners right at our fingertips. We can contact them via their cell phones or their office phones any time of day that we want to. We also have weekly meetings, PT, OT, and speech. We meet weekly and we talk about each individual's care so that we can collaborate and make sure we're giving them the best care and getting them better as quick as we possibly can. Also, like I had mentioned, we are the only facility within the greater Hazleton area with this equipment, and it really kind of fine-tunes your balance and gets you right back to where you need to be.
So when you have the team effort, which is so important, everyone's experience in different areas, okay, so you can confer, right? So you're conferring with the other team efforts, and maybe the results from one comes to you and you'll be able to decide just what happens, okay? All right. So once again, very quickly, how do we know we have a concussion?
So if you have any injury and you have hit your head and you're feeling dizzy, nauseous, mental fogginess, extreme fatigue, even aggression sometimes, sadness, any symptoms that are not normal to you, you may have a concussion and you should consult your primary care physician or see an emergency department.
Okay, and folks, the number to call is 570-5014-LVH. This is the concussion therapy team here at the Health and Wellness Center Rehab, fully equipped. Most importantly, folks, experienced people helping you, and they're great people, they really are. So hopefully you don't need them, but they're here if you do need them. And once again, folks, for all the healthcare people that are working in any system, give them a little slack once in a while, because they work pretty hard, and sometimes there's some stress, particularly in hospitals, etc. And so, give them a little slack, because they do a great job. Believe me, anyone in healthcare is doing a great job. We have great doctors, we have great nurses, we have great PAs, etc. Here in the greater Hazleton area. So it's just a fabulous opportunity for us. We'll see you next time.